From Studio 3C in Rockefeller Center, this is News 4 New York.
Now we want to talk about the insulin shortages impacting patients all across our country.
Better get Baquero for what patients need to know. Here is News 4 consumer reporter Lynda Baquero with expert advice from doctors.
To progressively increase production. With an increasing demand for diabetes drugs and recent shipping delays, Peter Ferdico worries about getting the insulin he needs.
It makes it difficult for diabetics like myself to get the medication.
Peter uses Humalog, and supplies of that and some other medications for type 1 and type 2 diabetes are tight these days. Dr. Kay Lovig is chief of endocrinology at White Plains Hospital.
And I don't think it's anything that, even within the world of endocrinology, we saw coming, and it's been quite a challenge.
One drug manufacturer, Novo Nordisk, tells us it's currently experiencing a short-term disruption of Novolog vials due to a delay in shipment from our manufacturing site. We expect shipments to resume to a normal schedule starting mid-April. Eli Lilly, which makes drugs to treat diabetes and manage weight loss, says we've experienced an unparalleled surge in demand. As a result, there's limited availability of several doses of Mounjaro, Zepbound, and Trulicity. As for Humalog, the market and supply chain continue to be dynamic, so some pharmacies may still experience intermittent outages. So what are you doing to try to get around it?
I just have to wait. I tried different pharmacies, they all have the same issue.
We asked Dr. Lovig what advice she has for patients to make sure that their supply of medicine is not interrupted.
You want to be ahead of the game, so I would say at least a week, if not longer, for when you're due for a refill. You want to check in with your pharmacy and see if they have these medications available to you.
For vials of insulin, like Humalog,
you can always ask to transition to an insulin pen of the same type of insulin.
For non-insulin injectables to manage diabetes and weight loss, Eli Lilly says we expect our investments in manufacturing and supply capacity to progressively increase productions of our medicines throughout 2024 and beyond.
Well, I hope they're right, and I hope, they can really do some work for the individuals who really need this medication.
In Armonk, Lynda Baquero, News 4 New York.